see. Hey, Kristen. Kristen, is the audio okay? Can you type and let me know? Okay, great. Thank you. Let's see how many people show up. I'll wait maybe till like a minute or two after, like 4:01, 4:02. I'll be back in 1 second. Oops. All right. Just you and me. Somebody sent me money through PayPal, so maybe it's just taking them a minute to. Has anyone shown up? No, it's just no one's on Facebook on the weekend. Is that the problem? All right, because I know people probably are pretty interested in treating fevers. There we go. There's April. Okay. Hi, April. We'll give it. Why don't we give it? We'll give it till 5 after. We got 3 more minutes. See if maybe 1 or 2 more people pop in, and then we'll get started. Okay. Have some pretty interesting things. I was writing down, taking notes on what I wanted to cover. Obviously, I can share my. I'm going to share my my screen with you guys, and so you'll see what I'm doing in the rubrics that I'm covering. But if you have questions, I think there's an area where you can type in questions, and then it like alerts me to let me know that there's a question, and then I can go, and so it's a little more interactive instead of me just sitting here blabbing for an hour and a half. Okay, because I do want to make the most of everyone's time. So if you have specific questions, ask me, and if I have the answer, then I will answer it. I do have a book that I want to recommend because I'm going to talk about fever. I'm going to talk about not just the types, like there's antiquated terms that are used for fever in the repertory. So we can talk about those a little bit, but then there's also how a fever unfolds, and I'll talk about that, and I'll show you where the rubrics for that are. They're really, really important, especially if it's not a typical fever where there's chill and then heat and then perspiration. That's a very common cycle, right? So the person feels chilled because the body temperatures are reset at a higher temperature, so they feel cold. Then the body you can have shivering or other ways where the body heats up, and then it gets to a certain point and the person goes through the heat phase, and then they go through the perspiration phase. But there are other ways and that can all present. Let's see, 1 more minute and then we'll get started. Okay, I'll just show you guys the book. So this book right here, Desktop Companion by Roger Morrison. Okay, in it, not only does he cover, you can see there, influenza, and they're just top remedies with indications. So if you look at, let's just say eupatorium there. I'm seeing this backwards. I hope you guys aren't seeing it backwards. Eupatorium, and we'll give you key indications for that remedy. Then there's a whole chapter on fever there. And I'm showing this to let you know that the book is out there. And it tells you about homeopathic indications, naturopathic indications, and then it gets into glossary terms for fever. And so under fever glossary terms, there's anticipating fever, and then he gives you the definition. Paroxysm of fever, which return earlier than its expected hour in malaria. Okay, that's an anticipating fever. Ascending fever, the heat that travels up the body. Bilious fever, cerebral spinal fever. Okay, so I'll just show you guys. There's just different terms. Morrison, he defines those terms in this book. desktop companion. You might be able to find this used online. I don't know, 50, $60. Brand new, I think it's like 120 or something like that. But anyway, it's not just fever. Desktop companion also has head and neck, which cover headaches, chest, cough, uncomplicated cough, croup, pertussis, pneumonia, asthma, cardiac conditions, GI, nausea and vomiting, diarrhea, abdominal pain, liver disorders, genital urinary, kidney stones, prostate, musculoskeletal, arthritis, tendinitis, rheumatic arthritis, injuries, bruises, sprains, fractures. It's pretty in depth. Skin diseases, eczema, psoriasis, cracking of the skin, urticaria, vertigo, influenza, fever, and then neurological conditions at the end. So he came out with this book, and I think he's coming out with another version soon. It's either this or the blue one that's the not the desktop companion, it's the desktop reference. Anyway, I found it a very good book that I've used over the years. Let's see, I'm going to go ahead and share my desktop with you all. Okay, get rid of that. And I'm going to put this up in the corner. Okay. Just a little bit smaller. Okay. Well, it's 8 after, so why don't we go ahead and get started? So I wanted to talk about fevers because they're very common, and you're both part of the Homeopathy is for Everybody group, and there's a lot of beginners that don't know a whole lot about homeopathy, and so they just say, I have a cough, what can I take? My child's got a fever, what can I give? And obviously it's not as easy and straightforward as that. So what I wanted to do was just kind of get a grip on, present some information so we can get a grip on fevers. I think number one, you know that fevers are, they're important, right? It was, I believe it was Hippocrates that said, give me a fever and I can cure anything. So it's not something that you want to suppress, okay? There are fevers that are just kind of run-of-the-mill fevers, like a cough and a fever. The main thing you want to watch out for, or look out for when there's fever involved, is where is the itis, right? Where's the inflammation? Because I'll just take a little step back here. When you have a fever, there's usually inflammation associated with it somewhere, right? And the Greeks basically broke down inflammation to 4 things: tumor, which is swelling; rubor, which is redness; calor, which is heat; and dolor, which is pain. So heat, pain, swelling, and redness. And it doesn't matter where that inflammation, and so you don't need all 4 of those things. You don't need heat, pain, swelling, and redness. You can just have redness and some pain. You can have pain and some swelling. You can have heat and some pain. So you don't, or you can have all 3, or 3 out of the 4, or all 4. So the main thing you want to figure out, if you can, is where is that inflammation, that itis, right? There's pneumonitis, which is pneumonia. There's appendicitis. There's gastritis. So anytime you see itis, it's inflammation of. The main things that we want to make sure that there is an inflammation of, right, because it can lead to complications, are meningitis, inflammation of the meninges; encephalitis, inflammation of the brain; there's orbital cellulitis, like cellulitis around the eye, because that infection can spread back to the brain, right? Because the main thing that we're concerned with when we talk about inflammation is it going to affect the brainstem, because that's where the heart rate and the respiration, the impulses for that to happen reside. So if you have localized inflammation in the joint, probably not a problem. You have mild inflammation in the bronchial tubes, bronchitis, not a problem. You have laryngitis or tonsillitis or pharyngitis, usually not a problem. So you really want to get an understanding of where is this itis? Where is it taking place? Okay. And then that's what physical exams and things are for. And then you take child, or you take yourself to professionals so they can do clinical physical diagnosis, do your vitals, look at the tongue, auscultate, percuss, and figure out where the inflammation is, the heat, pain, swelling, and redness, because usually with attached to those things, that's where the fever usually resides. So I just want to cover some basic things that you would really raise some alarm bells, okay, with a fever. If you have a fever that comes on suddenly and with it, there's lethargy, right? So the fever spikes really high. Anytime there's fever and there's just really, it's almost, there's a stupor with the fever, okay? So as an example, we would look under mind, stupefied, stupefaction. There should be a rubric for fever. Fever during 24 remedies. You got Gelsemium, which is a big acute remedy, hyoscyamus, opium, nux, pulsatilla are the big ones. But so when the person's level of consciousness starts to drop, right? You see a child, they're running around with 100 point, a 101 or 101.5, and they're still playing with their siblings, and they have a fever. That's not a problem, okay? The fever's gonna run its course, and they're gonna be better. Loss of appetite is usually normal when there's a fever, okay? I typically tell people, don't feed people, especially if there's no appetite, if they have a fever. Anything over 99, I usually have them on very light broth or water. The other thing you want to look out for is what's called nuchal rigidity. The back of the neck is the nape, and so nuchal rigidity is a stiff neck. Okay, and that is an indication of meningitis. You want to watch out for that. Other things, really severe, painful cough, or any cough that sounds like it's obstructing the lungs. So they're having a hard time breathing, accelerated respiration. There are rubrics. If you look at the remedy, here, let me show you this really quickly. I believe antimonium tartaricum, which is a big remedy for respiratory problems with pneumonia. It's using accessory muscles with respiration. Respiration. So I'm just gonna look in the respiration chapter, and I also think it's under chest, the chest chapter. The point I'm trying to make here is difficult respiration must use accessory muscles, right? So these are all big remedies that are for acutes. Antimonium tartaricum, arsenicum, accessory muscles are the scalenes here on the side of the neck. If they're having to breathe in and use, have you ever seen somebody that has labored breathing where they're trying to breathe and they're really pulling into the abdomen to try to get a breath in? Those are all issues that you would see with somebody's having difficulty with breathing. The other thing you want to look out for, if there's hypoxia, so they're not getting oxygen in and there's a lack of exchange of oxygen and carbon dioxide, is you'll get blueness or cyanosis. So if the lips are blue, if the fingertips are blue, the face is blue, there's a rubric chest, cyanosis of the chest. Okay, can you imagine? And lachesis, laurocerasis, antimonium tartaricum. That's blueness of the chest, which would indicate lack of oxygen. So again, we need oxygen for life. We need good blood perfusion, blood flow. We need our brain to be working in order. So these are some of the signs that we're looking for. I could go on and on about these things that would raise red flags for me, like, ooh, this person is going from sick to what we call the layperson's term, or how it was termed to me was from sick to bad sick, right? Bad sick is what I'm trying to describe, what you want to look out for. Loss of consciousness, stupor. So they're going in and out of consciousness with a fever, not good. Nuchal rigidity, severe headache, inability to breathe appropriately. And the last thing that I want to just touch on, it's under mind, shrieking, brain cry. Okay, this is a big one. The main remedy is apis, and brain cry is also called cry, encephalitic cry. And it sounds like a cat. It's also called cat's cry. So it's usually a baby, infant, or toddler, and they sound literally like a cat. Okay, so if they have a fever and they're screeching like a cat, it could be a really strong indication for encephalitis. Okay, the rubric that corresponds to shrieking and or brain cry is under fever, cerebral spinal fever. Okay, cerebral, brain, spinal cord, and fever because of inflammation. And look, there we see apis again. Apis is a big remedy for encephalitis and meningitis, especially after concussion or head injury. Main reason for that, let's tie it back to the four things that make up inflammation. One of them being tumor, which is swelling. Apis is a huge remedy for swelling. So if you have inflammation of the meninges or the spinal cord or the brain, right, you have excessive, what they call it, fluid on the brain, water on the brain, hydrocephaly. If that's one of the main things that's prominent in one of the four key factors of inflammation, swelling, apis is probably going to be a good remedy for it. Okay. In that case, of course, you want to take the whole case, but apis is a big remedy for acutes. So there are different types of fevers. If you look under here, it says delirium and meningitis, cerebrospinalis, inflammation of the meninges, back inflammation of membrane. So these are all just different ways that doctors, the rubrics that they use and the terminology they use to point to meningitis. And so I'm bringing this up because meningitis is one of the things you really have to be on your P's and Q's about. Probably need a professional help if there's fever associated with meningitis and encephalitis. Okay. So, and I've seen homeopathy and hydrotherapy treat meningitis. It's not untreatable other than, a hospital visit. So first thing, I guess, let me see. And again, if you have any questions, there's a little box that you should be able to find. I have Q&A. So just stop me if I'm going too fast, or if you're like, wait a minute, what about this? Or so any questions at all. Okay. So let's start with the fever. So there's a whole chapter on fever, and it's down here next to chill. So chill, fever, perspiration, they should all be together because these are usually components of a fever. Now, what I was mentioning earlier is the succession of stages. So we go to fever, stages, succession of stages. Okay, so this is the rubric here. And you'll find this in synthesis. Okay, we can look in Kent to see where it is if you're using Kent. So fever, succession of stages. So what's the first stage? Is it a chill? Is it heat? Is it perspiration? Because you can have any of these, okay, or shivering. And then what happens after that? So there's a pattern. So let's say the first thing that the typical is they have a chill, and then is it internal or external, or is it followed by, right? Let's just go with followed by heat. And then we can go, there should be then chill, then perspiration, especially of the face. Okay, so the doctors really took a long time to kind of break down these succession of stages. So we're on chill, followed by heat, heat with perspiration, or then perspiration. Okay, that's the typical, the fever breaks with the perspiration. And these are your main remedies. There's arsenicum, china, ipecac, nux vomica, pulsatilla. You've got some smaller remedies, calinitricum, Chinenum arsenicosum, Sina, Cedron. So depending on how the fever is presenting, right? We can back up a little bit. I'm just backspacing here. What if they start with perspiration, right? And then it's followed by heat, followed by chill. One remedy. Wow, eucalyptus. Okay, because it's not typical for the first phase of fever just to be perspiration. We can back up on that a little bit. Boom, 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 boom. So there's followed by chill, then perspiration. Nux moscata. I don't know if you guys know nux moscata as a remedy for fever. It's a nutmeg. Okay, not nux vomica. There's nux V and there's nux M, which is nutmeg. Nux V is the vomiting nut. What's interesting is when you study these remedies that have to do with fever, most of them are in the acute, typhoid, or malarial miasm. Nux is typhoid. Nux moscata, typhoid. China, malarial. Spigelia, malarial. So that's another way to look at remedy. Or here you have Helleborus, that's typhoid. Belladonna is acute. Chamomile, typhoid. So these remedies that we use that are indicated based on the totality of symptoms are usually indicated in here because of the miasm that they come from. Okay. So I wanted to point that out, the succession of stages. Another way to look at, so when a fever starts, what we want to do is we want to take an inventory of what symptoms are happening, right? Because if we just go to just fever, right? Fever, heat in general, 292 remedies are in this rubric itself, right? Obviously no specificity, nothing to prescribe on there. So what do we look for? What was the exciting cause, right? Main remedy, when there's a cold, dry wind, sudden cold, dry wind, suddenly the fever spikes, right? It's early inflammation. Main remedy for that would be aconite, right? So what is the etiology? What's causing the fever, right? There's actually rubrics. So I'll give you an example. If we go to fever, fever, tropical. So these are remedies that are used for fevers that start in the tropics, right? So somebody goes to visit Thailand, Cambodia, India, Africa, somewhere, but they're in a tropical zone and they come back, or while they're there, they develop a fever. You want to consider these remedies, okay? There's also fever, traumatic fever, right? You go, what's a traumatic fever? Traumatic fever is a fever that happens because of accident. So somebody fractures their leg and they develop a fever. Somebody gets a head injury, they develop a fever. Somebody has a really severe laceration somewhere, and because of the trauma, they develop a fever along with it, okay? The more unique it is, the more it should get your attention. So we see the injury remedies. Arnica's in there, apis is in there, aconite's in. These are all injury remedies. Bryony is an injury remedy. Arsenicum is a big remedy for burns. So they've got a second or third degree burn on most of their arm, and they've developed a fever. That's a traumatic fever. So you would look at arsenicum. Calendula is a big injury remedy. We can go down through those. So there's injury remedies amongst this rubric for traumatic fever. So when the fever develops, we want to look at its pace. Did it come on slowly? Did it come on quickly? Right? And there are actually rubrics for that, I believe. It should be under appearing gradually. So we just take a look at that. Fever appearing gradually. How do we define gradually? It usually starts to come on very slowly over a period of, I would say, more than a couple of hours, more than 6 hours, right? Because usually fevers come on, they start to come on, and within a couple of hours, the person's febrile. So appearing gradually, disappearing suddenly, you've got belladonna, sulfuric acid, acute miasm. Most of the acids, except for nitric acid, are all typhoid miasm. Appearing suddenly, disappearing suddenly. Boger has Thuya as a main remedy. We talked about the ascending fever, so the heat starts in the feet and works its way up. The other thing you want to be aware of when you're talking about fever is the heat. Is it internal or external? Is it chill, internal or external? So the person, my skin's burning, but I feel so cold inside. Okay, pay attention to that. There's also fever with the heat as an example. In spots, single parts. There's one where it's half of the body. I'm not going to waste too much time looking for it. Where does it begin, right? Like heat beginning in the abdomen or beginning in the feet. Where the chill starts is really, really important. Okay, so somebody has a chill, You know, they've gone through the heat phase or before the heat phase, but they're in the chill phase. They're really cold. They want to get warm. You can either go chill, right? So we just jumped from fever chapter to chill chapter, beginning in, and then if you like it, like beginning in the lips, bryonia is the main remedy, right? The chill begins in the lips. Chill extending from the spine to the arms, leptandra. In the pit of chill begins in the pit of the stomach, or in the thighs, or in the toes, right? So, what are we talking about right here? We're talking about location, right? And if you go back to Eugene Nash's, E.B. Nash's, How to Take the Case and Find the Simillimum, location is huge, right? Sensation, location, concomitants, modalities, really kind of like, and then you look at constitution and temperament. But those things are really, really important. Okay. So chills, appetite, pupils, like what can you do? You know, if you're at home and you want to manage the fever, take the pulse, right? And the reason I say take the pulse, look at here. Let me just get rid of this. So I'm going to type in fever and pulse. And so pulse is going to be in the generals. Okay. So we just look under repertory. And Kent has head pulsating, beating, throbbing during fever. Belladonna should be in there. There's belladonna and eupatorium. Back pulsating lumbar. So he doesn't really have any rubrics for the pulse itself. But if you go to Schroyen, which is synthesis, we're going to touch on this rubric here. Pulsations of blood vessels during fever. Pulsations externally, internally, right? Pulse fluttering. Pulse frequent. Pulse irregular. Pulse slow in fever. So this is normal for fever. As the temperature goes up, the pulse tends to go up. Okay, so pulse frequent during fever, 6 remedies. I'm not sure if I'm going to take that as a rubric, but if it's inverse, right, as the temperature is going up, you know, if a normal pulse is 70 beats a minute and the person's got a pulse of 78 or 70 or lower, and their temperature is 100, 101, 102, and their pulse is low, that doesn't make sense. So the rubric for that is here. General's pulse discordant with temperature, right? It's not concordant. It's not going up with the temperature. It's flipped. It's inversed. And the main remedy for that, and it's been like you see all the authors here. You've got Clark, you've got Oscar Boricke, you've got Grimer, Julian Othon, you've got Kent, Morrison, Patak, Pierre Schmidt. They're all saying the main remedy, and it is a keynote for pyrogenum, is this discordant pulse, right? So the temperature and the pulse are not going up together. That said, you've got pyrogenum. Echinacea is a grade 2, and SNE is Andre Sain. So he's seen echinacea also has this pulse discordant with temperature. Some other remedies, Veratrum V. Veratrum verde is associated with the Veratrum album, but it's in typhoid miasm. And it tends to have a lot of issues with the pulse when it comes to fever, okay, and seizures and things like that. There's usually, I had a case 2 years ago where I used Veratrum verde with really good results in a case of tachycardia. With the pulse was involved with seizures and convulsions. Okay, let's see. So things you want to look for. Okay, we want to look for changes in their mental status. So the way that you can study that or look at that is you type in fever, and then you go to the mind chapter, right? So, and when you use these, it should not be characteristics for the person's temperament. So if you have somebody that's just very happy-go-lucky, they just generally very even keeled as far as their mood goes, and they develop a fever, and with it they're really, really irritable, then you can use, if they're angry, they use anger, or you can use, it should be irritability and fever. It should be FGH. Irritability during fever. Okay. And nat carb is the main remedy for that. And again, nat carb is typically selfless, right? They can present a lot like staphysagria, where they're very reserved and very mild. They can suppress their anger a lot like staphysagria. They don't want to hurt other people's feelings because they're very selfless in nature, but they can also be quite, just like staphysagria, quite irritable. But anyway, the point I'm trying to make here is if somebody tends to be irritable and they get a fever and their irritability ticks up a notch or two, I wouldn't really use it. You have to use what's uncommon for the person's healthy nature. Okay, think about that. And if you're treating your kids, you know your kid's nature better than anybody. So if you're like, wow, that's really uncharacteristic for so-and-so, as far as their behavior, normally they don't cry. And they've been crying ever since they've been sick. They have a fever, then we go to mind, weeping. There should be a rubric. It's actually whimpering during fever. So if this is not characteristic for their behavior, but they're whimpering and weeping during their fever, there's pulsatilla, there's rheum, belladonna, chamomile, okay? Acute miasm for belladonna, typhoid miasm for chamomile, typhoid miasm for rheum, and pulsatilla is psychotic. Okay, so mental symptoms. Let's take a look at a couple more. Industrious during fever, right? Getting really busy, wanting to do things, kind of unique. Laziness during fever. Lamenting. Loquacious during fever. You can also, there's a lot of delirium, okay? So we'll take a quick look at that. Delirium, fever with intense fever. Muttering, loquacious. So if they're just talking and prattling, there should be a rubric for prattling as well. Delirium, gay and cheerful during fever. Take a look at this belladonna again. So stramonium, belladonna, hyoscyamus, right? Acute miasm for stramonium, and typhoid miasm. Veratrum is acute miasm. But there's a lot of delirium in fever in the Solanaceae family. The belladonna, Solanaceae, hyoscyamus, and stramonium are all Solanaceae. Okay. So what's unique on the mentally and emotionally? There's fear, despair, excitement. Fear during fever. Okay. Again, I look at the authors here. You've got Fatak, you've got Boger, Tak, Boger, really, really reputable doctors. So if they're characteristically not fearful and they become fearful and they have a fever, you use this rubric. It's a concomitant, okay? It's a mental concomitant with fever. There's Nux moscata again, nutmeg. Okay, ipecac. You're going to find ipecac come up over it, and ipecac is not just for nausea. Ipecac is a huge remedy for cough. Ipecac is a huge remedy for whooping cough. Ipecac is a huge remedy for hemorrhaging. As a matter of fact, as an aside, anytime there's hemorrhaging with nausea, ipecac is the only remedy. Okay, and the blood is usually arterial, so it's bright red. So nausea and vomiting, persistent nausea, then cough, whooping cough, and then hemorrhage. And just to show you as an aside, if you go to nose, epistaxis, during whooping cough, you're going to see arnica's there, drosera, and there's ipecac as a grade 3. Okay. So again, that's a good a rubric to use because you have a concomitant. The whooping cough is so violent, it's causing a nosebleed. And there's your little Kunze note right there, letting you know that if the symptom is present, the remedy has to be in this rubric. Okay. So go back to mental symptoms. You've got fear, excitement, gestures, picking at the bedclothes during fever. This is carphalosia. Okay. Again, belladonna, muriatic acid, phosphoric acid, opium, hyoscyamus. Those are the main remedies. Let me show you another rubric because muriatic acid is in there, phosphoric acid is in there. These are the remedies that were used to treat really, really severe cases of typhoid fever. Okay. These come up very strongly. I'm just going to show you the rubric because if you see it, this is where the person is so weak. Remember, I talked about weakness and how would be a red flag, that they slide down in bed. I'm I don't want to waste too much time looking for the rubric. So I know it's under generals. It's under sliding. And I'm just going to look under generals. And then we'll find the rubric. General sliding down in bed. Weakness, sliding. This is the rubric right here. General's weakness, paralytic. Sliding down in bed from a half sitting position. There's muriatic acid, phosphoric acid, and phosphorus are the main remedies. Arnica is going to be in there, antimonium tartaricum. So essentially, they're either propped up or they're trying to sit up, and because they're so weak, they can't hold themselves up, so they start to slide down. Here we have sliding down in bed during chill, muriatic acid. Sliding down in bed during fever, muriatic acid. During perspiration, muriatic acid. So in arsenicum, we know arsenicum has a lot of weakness, right? When they're in their failed state. So this is just another example of a good rubric that you can use for somebody who's, somebody is that weak with their fever. They need to be treated by a professional. Okay. So I talked about not feeding people when they have a fever, best to water fast or light broth or diluted herbal tea. Observe, are they perspiring, right? Are they perspiring just from the forehead, just from the nose? Is it, what part of the body is perspiring? There's a full body perspiration. That doesn't give you a whole lot of information. The other thing that you want to look out for is respiration, hot. The breath is hot or the breath is cold. Okay. Hot breath, aconite, right? Aconite has a really high, dry fever. And so if you go and you put the back of your hand to their mouth and their breath is really, really hot, you want to use this rubric. Here you have, I'm just going to check and see. I'm getting some Facebook notifications. I'm going to see if anybody else is, like, if they're trying to pop in. They're having trouble. Nope. So look at this rubric here. Respiration, hot breath during chill. And you have rust tox. Again, rust tox, big remedy for fever. Should have restlessness. If they have stiffness or nuchal rigidity, that would be an indication for rust tox. It's typhoid miasm. So again, big remedy for and what's the essence of the typhoid miasm? The essence of the typhoid miasm is urgency, right? So if you're looking at somebody, looking at a family member, you're looking at somebody who is in an urgent state, you get the sense of urgency, like, I need to do something about this if it's your responsibility, or I need to take this person to somebody really quick because I feel urgent. That's letting you know that it could potentially be typhoid miasm because you feel a sense of urgency. Okay. There's a way to repertorize in the computer program to get to just you looking at remedies that are from the acute miasm and the typhoid miasm and so on. Another rubric you want to consider is coldness of the breath, right? And we're going to see remedies. Camphor, huge remedy for acutes, right? Cold perspiration across the forehead, cold breath, blue lips, having a hard time breathing, but they don't want to be covered, right? And you can read up on camphor. I can double click on it. Coldness and blue discoloration, so cyanosis. Icy cold but wants not to be covered. That's a keynote for them. Okay. Collapse, weakness, cramps and convulsions. Camphor's acute miasm. It's the main remedy for cholera. We go down a little bit. The face is pale, pallor alternating with redness, bluish, cold. Okay, cold sweat like veratrum. Go down a little bit further. Coldness of the abdomen, rectum, cholera. It's, again, main remedy for cholera. So let's just go back to the rubrics. Coldness of the breath, carbo-veg, collapsed state, right? Desires to be fanned. They want the windows open. They want a fan on them. They need moving air. Typhoid miasm for carbo-veg, okay? Veratrum album again. So your differential on cold breath is, if you're not going to repertorize, is camphor, carbo-veg, and veratrum. Let's see, rubrics. We've talked about some mental rubrics. Delirium, fears, are they morose or sad as soon as the fever comes on? Another good one is respiration or breathing. So that's going to be under the respiration chapter. And so under respiration, there's a rubric for sighing. So I'm just going to look up fever. So what I'm doing is I'm taking this word, fever, and I'm looking in the respiration chapter. I'm looking in all repertories. And so respiration, anxious during fever, right? Arrested, deep, respiration deep during fever. Double click on that. Aurum, borax, bryonia, capsicum, muriatic acid, phosphoric acid, ipecac. So the thing is, the interesting thing about homeopathy is like when you really spend the time to study it and you look at either conditions or you look at tissues or you look at a part of the body, the same remedies start to come up over and over and over again because there's an affinity, right? There are patterns to remedies and how they relate to physiology in the human body. So you study fever, you're going to see the same remedy. The same 36 remedies will probably cover 90% of the fevers that you ever have to deal with. Okay, so you don't feel overwhelmed that you have to deal with what was it, 250 or so remedies. You want to start with that assumption that it could be any remedy, but it really depends on the amount of time you have, the resources you have available to you to assess, and the uniqueness of symptoms. You know, how good are you? How well versed are you at case taking? So respiration again, hot breath during fever. Drag this over that main remedy. Zinc, interesting. Sighing during fever. Aconite, ailanthus, which is another big fever remedy. Bryonia, cocculus, ignatia, ipecac, lachesis. So you want to look at respiration. The other thing you want to look at, and this is where to find it, this is really important, but it has to be unique. Remember I said, we'll just do stomach, because I want to look up fever in relationship to thirst and fever in relationship to appetite. So we'll look in the stomach chapter, and we're looking up fever. Again, usually with fever, there's moderate thirst, and there's usually a lack of appetite. Okay, so under stomach, appetite diminished during fever, it's a useless rubric. Okay, but I'll show you some that are not useless. So appetite increased after fever, before, during aggravates. Okay, and you have to pay attention. Does this person get ravenously hungry and then the fever came on, or after the fever, do they get really hungry, or is it during? And we'll look at during. Appetite, stomach appetite increased, fever during aggravates. Main remedy, phosphorus, is a grade 4, and you have a Kunzli dot there. Okay, so that's telling you that Jos Kunzli found that when the person's appetite increased during fever, which again is unusual, it's like the discordant pulse with the temperature, that you really want to take a hard look at phosphorus as a remedy. Okay, so but we don't want to discard the other remedies. I mean, herring, boreki, herring, Kent, Fatak have all confirmed China, cinchona, as a good remedy for the rubric or the symptom of appetite increasing during fever. China, Sina, curare, which is interesting. It's a really small remedy. We consider it a small remedy because there's not a lot of information about it. Eupatorium purpureum. Okay, this is not Eupatorium perfoliatum. Eupatorium purpureum, and you see there UPPUR. There's EUPPUR, which is purpureum, and Eupatorium perfoliatum, and it's the perfoliatum that we typically think about when there's deep bone pain, as if the bones are breaking during fever or in influenza. That's a Eupatorium perfoliatum, PER. You've got hellebores in there. Again, hellebores is a big remedy for stupor and delirium and during fever. You know, they'll rouse, not too sure where they are, and then they kind of go back into their stupor. It's typhoid miasm, podophyllum, typhoid miasm. Okay, so you're going to see a lot of typhoid, acute, malarial. Eupatorium perfoliatum is malarial. Phosphorus happens to be tubercular. Okay. So again, appetite and thirst. So increase ravenous before or ravenous during. Double click on that. Ravenous appetite during fever, again, doesn't make a whole lot of sense. And so you have arsenicum, bryonia, capsicum, chamomile, china, senna, phosphorus. You're going to see the same players. And every once in a while, you'll see a little abbreviation for a remedy. And you're like, oh, what's that? Like, you know, oleander. We don't really think of oleander as a remedy for fever, but there it is. Or, you know, stannum is a remedy for fever. A lot of weakness, especially a sense of weakness in the chest, which is worse from talking. Cicali cornutum, we don't usually think of as for fever. We think of cicali more for sepsis, for issues with regard to insanity, and sepsis, gangrene, and convulsions is another one. So that's appetite, and then sense of emptiness. There's eructations, like burping, right? So what are many of these things that we're looking at? They're concomitants. With the fever, this thing arose. With the fever, this symptom arose. And that's really what we're looking for. And that symptom that comes up, is that unique to that person, to their temperament, and to who they are? Or is it completely opposite, right? As far as, you know, the mental, emotional state. You know, are these like laughing, lighthearted, jovial? They get a fever and they're sad and they're crying, and you know that's unique. I would pay attention to that. Flushes of heat in the pit of the stomach during fever. Okay, it would be hard to get somebody to describe that. Main remedy is Kubiba, which, if I'm not mistaken, is in the typhoid miasm. Hiccups during fever. Magphos. Arsenicum, Crotalus horridus. Okay, so again, what concomitant symptoms are coming up? Which concomitant symptoms are unique? Nausea, right? Nausea after fever, before, at the close of fever. What remedy is that? Eupatorium, there's perfoliatum, see? So not purpura. Eupatorium perfoliatum, not Eupatorium purpurum. There they are side by side. So the rubric nausea, fever during aggravates. Eupatorium perfoliatum is a grade 2. Eupatorium purpurum is a grade 1. And then stomach pain during fever, and then thirst. Okay. Does the thirst, and then these are some rubrics that they're kind of taught to you when you're learning acutes. There's thirstless during fever, which is kind of common. You have 119 remedies. But thirst for large quantities or small quantities, and often, right? So here's some rubrics. Stomach thirst for large quantities at long intervals. Bryonia, dryonia, right? Bryonia is the main remedy for great thirst, very dry mouth, wanting long gulps of water with the fever, or when they're in an acute bryonia state. Thirst for large quantities and often, because there's also for sips. Let me see if I can find the rubric. Large quantities, long intervals, often, and then there's a rubric for sipping, or small thirst, small quantities, and often. So that's just little sips of water, little sips of tea or broth or whatever it is. Okay, and arsenicum and lycopodium are the main remedies. Thirst, small quantities during fever. Arsenicum, lycopodium, belladonna, antimonium tart. Okay, and often. Okay, so just some familiarizing you with some of the jargon, because that's really when you study homeopathy, you study the repertory, um, understanding the terminology is really, really important. That in itself is a study. Is a study. Okay, just want to see. Okay. Ba, ba, ba. What are they craving or are they thirsting for? Right? Um, are they thirsting for cold drinks? Cold water ameliorates in short intervals, right? Are they wanting warm drinks? Here's an interesting rubric. It's under vomiting. Vomiting, cold. It's a rubric where they drink something cold and when it warms in the stomach. Vomiting. Warm drinks. Give me 1 second to find it. It is under the main remedy is phosphorus. Phosphorus, and I'll just look up vomiting. And they drink cold. 138 remedy rubrics. There it is right there. Stomach, vomiting, drinking as soon as water becomes warm in the stomach. So they drink cold water and then it warms up. And then, so what are you thinking? 10 to 20, maybe 30 minutes after they drink cold water, they vomit it back up. Vomiting of liquids as soon as they become warm in the stomach. Okay, look at that. There's phosphorus, chloroform, pyrogenum. Okay, so the main remedy for that is phosphorus. So you give them, the phosphorus likes cold drinks. They drink it cold. They don't like warm drinks. It warms up in the stomach. Their body rejects it and they vomit. Okay. The other things I wanted to talk about with regard to fever, we talked about pulse. Let's look at the eyes and fever. Okay? These are things that you can observe. You don't need tools. You can look at the skin. You can look in the mouth. You can look at their their bowel habits. So we're going to look up fever, and let's just look at we'll look in the eyes, nose. The other thing that you really want to take a look at that can really give you good information with acutes is look at the tongue. So we're going to look at the mouth. Okay. Let's see, and all repertories. Before I jump to this, I just want to show you something. We talked about Veratrum verde, right? The green Veratrum, not Veratrum album, which is white Veratrum. It's a big remedy for inflammation of the lungs. And one of its keynotes is under mouth, discoloration of the tongue with a red stripe down the center. Okay, so you have your Kunzi dot, there's Veratrum verde, there's causticum, there's pyrogenum. So if you look at the tongue and there's a red stripe running down the center, that is homeopathic gold right there. Okay, they've got a fever, red stripe running down the center. You get one or two other symptoms, and you'll find your remedy. Okay, but I found this to be a very good one. And there's the rubric as well. Tongue red center of the tongue is red, or a red stripe down the center. Okay, and again, rus tox, rus v venata, sanguinaria, phosphorus, phosphoric acid. So you don't just want to think, oh, red stripe down the tongue, Veratrum verde, and causticum. They're good ones to think about as far as keynotes, but arsenicum has it, belladonna, baptisia, which is a big remedy for typhoid fever. Osmium metallicum, okay, palladium, some metals, iris versicolor. So we don't want to just ascribe one unique symptom to one remedy unless it's the only remedy in the repertory. Okay, so I wanted to touch on that before we get back to looking at the eyes and the nose and the mouth in relationship to fever. Okay, so again, look at the tongue. and there can be some information that can really help you to help whoever it is you're trying to treat. Dryness of the eyes during fever, again, that has to be, they never complain about their eyes, and as soon as the fever comes on, their eyes are dry. They just dry out, okay? Glassy appearance, okay, during fever. Belladonna is going to be in there, bryonia. Glonoinum and belladonna are very, very similar in the presentation. Lots of pulsating, lots of headache, pulsating using the temples or the crown of the head. They're both acute miasm, so they come on really quickly. You have to do a bit of a differential between belladonna and glonoinum in my experience. Itching of the eyes, lacrimation, tearing of the eyes during fever. So the fever comes on, tearing, okay? I found this to be a really good rubric when there's a cough. So they're coughing and their eyes start to water, good rubric. That's a good concomitant. Main remedy for tearing with fever, pulsatilla, but then sabadilla's there, gelsemium, there's eupatorium again, apis, belladonna, chamomile, ailanthus. Again, remedies are going to come up over and over and over again, and you'll familiarize yourself with them. Pain in the eye during fever, okay? 39 remedies, okay? There's valerian, right? You don't really think of valerian as an acute remedy, but I would look to see what kind of pain. I would do a little research to see, okay, valerian eye pain and see what comes up. Or I'd look into general's pain and see what kind of pain valerian has. Okay. Photophobia during fever, protrusion of the eyes during fever. Here's a good one. Pupils contracted during fever or pupils dilated, right? But they have to be really dilated or have to be really contracted. Strabismus during fever, that's not a good sign. There's apis, right? It makes sense. Apis is a big remedy. If you have a fever and you develop strabismus where the eyes are not lined up anymore, not a good sign. That's letting you know that the central nervous system is involved. So it could be an indication of meningitis or encephalitis. And what's our main remedy with the creencephalique, the brain cry? It's apis, okay? So if you had somebody that maybe they bumped their head, regardless of what the etiology is, but they've got that creencephalique and you notice that they've got strabismus, they've got a fever, I would probably give apis based on that alone. Eyes turned upward during fever. Again, that's not a good sign. Hellebores. Weakness of the eyes. That's the patient telling you, my eyes feel weak. Okay. Coryza. Oops. What is coryza? Coryza is clear, runny nasal discharge. So we look at coryza with fever. 54 remedies. It's not good. Due to a cold east wind. Okay. Farouk Master, aconite. Okay. And I've talked about, I alluded to earlier, aconite having symptoms that come on very suddenly from cold north or cold east wind, very dry wind. Okay, main remedy for that. Epistaxis, fever ameliorates. So they have a fever, they got a nosebleed, the fever gets better. Epistaxis during fever. Okay. And you have all your players again, aconite, arnica, belladonna, bryonia, carboveg. And these are all, the ones I just read off, they're acute miasm, typhoid miasm, malarial miasm. Not too sure what hamamelis is, Ignatius cancer miasm. But anyway, regardless of that, if you have a nosebleed during that comes on because of the fever, use that rubric. Hay fever, we're not talking about. Sneezing and hay fever, we're not talking about. Clean tongue, bleeding of the gums during fever. Okay, now we're getting into things like typhoid fever and so on. Discoloration of the tongue, yellow, red during fever, white during fever. So again, good rubrics when you look in the mouth, look at the tongue, look at the gums. Okay. There was something it just popped into my head and popped back out. We talked about perspiration, talked about appetite. Oh, here's another one I wanted to talk about, just as an aside. Cough. Increasing fever. fever. Maybe it's under fever. Fever. There's cough. I'm having a hard time finding these rubrics tonight. It's under, what happens is the cough increases the fever. So I'm just gonna look up cough, increase, fever. And we're gonna look up all those words. There it is, fever. Coughing increases the heat. So they're using heat instead of fever. Heat and fever are synonymous, okay? And some doctors, they use the word fever. Some doctors use the word heat. Some doctors use the word heat as part of that. Remember, we were talking about the succession of stages. You got the chill, the heat phase, and the perspiration. Some of them talk about the heat phase as the fever. Okay, so there's a little ambiguity there, which can be a little confusing. But if they have a fever and it's as they cough, the heat increases. This is your rubric. Okay, there's arnica, arsenicum, coccus cacti, which is made from a little bug that lives on cactus. There are a lot of rubrics to look in through heat, right? After heat, fever after anger. Chamomile, Staphysagria, sepia, big remedies for, that's ailments from anger. Okay. Fever after anger alternating with chill, nux vomica. And there's nux there after anger. Okay. Other things I wanted to touch on. Burping, eructations, type of. So if there's burping, it's under stomach. Eructations, that's the term. And it's a type of food, fever, during fever. So the burps are like the food that the person's eaten during fever. Sina, Ignatia, Ferrum. Let's look at fever and perspiration, because that is and then where's the perspiration? Again, location is really, really important. Fever, if they have no perspiration, it's going to tell you where to look. It's usually fever, perspiration, absent. 81 remedies, so it doesn't help us a whole lot. Okay. Also, if there's like fever with heat, doesn't help us. We have to look for things that are kind of unique or peculiar. Perspiration, fever, perspiration after fever. Okay, that's kind of normal. I wouldn't use that as a rubric. Let's look at sleep chapter. How does the fever affect the sleep? Comatose before fever, sleep disturbed, sleep disturbed after fever, dozing during fever. You have aconite, opium. You're always going to, anytime there's dozing or comatose sleep or snoring. Another rubric is stertorous breathing, like, okay, that's that is a strong indication for opium, especially if the face is red and looks really sleepy and they've got a fever and they can't keep their eyes open. You're looking at opium. Sleeplessness during fever, unrefreshed. I want to take just another approach. We're going to look at the word fever, and let's just look at opium as a remedy. We'll do a couple of these, okay? So opium and fever. Anxiety during fever, aphasia, so inability to find words with typhoid-like fever, anxious, attempts to escape during fever, okay? So that's a delirium, right? They're getting up, they jump out of bed and they run for the door. Frightened easily during fever, okay? So these are all, I mean, if you really take the time to look at these, the information here is so rich. We look over here, 167 rubrics that are associated with opium and fever. Involuntary motion of the hands, again, carphalosia, picking at the bedclothes in fever. Opium is a grade 3. I can also, if I want to like narrow that down, I want to, what are the keynotes with opium and fever? I can go here and get rid of the second, first degree. So I was just going to look at first degree, third and fourth degree rubrics for fever. So now we've went from 100 and something down to 29. Indifference during fever, stupefaction during fever, unconsciousness, right? Discoloration, red face during fever, dryness of the tongue, pain in the larynx. One of the things I've been working with people with acutes lately is when they say, oh, my throat hurts. I say, is it your throat, which is behind, or is it here in your voice box in your larynx? Because in the repertory, there's a huge difference, okay? You have to really understand, you know, when somebody says my throat, it's the same thing when somebody, oh, my tummy hurts. When they locate with their hand, again, location, when they locate, they're usually touching their abdomen. So it's not my stomach hurts, because we need to specify, we need to know, when you say your stomach hurts, are you talking about your abdomen or are you talking about your stomach? See where they point. Like, where's the pain? Where's the itching? Where's that sinking feeling? Because we need to repertorize this correctly. Okay, so the same thing with the larynx. Are they talking about the voice box, the larynx, or are they talking about the throat behind or up higher? Okay. Respiration rattling during fever. Nux moscata, sleepy remedy. Opium, sleepy remedy. So it makes sense that they would both be grade 3s. Nux moscata is one of our main remedies for what's it called? Sleeping sickness, where they just kind of fall asleep right then and there. That's somnolence. I'm forgetting the term I'm looking for right now. Inflammation of the lungs and typhoid fever, grade 3. Cerebral spinal, main remedy, cerebral spinal fever, main remedy for meningitis. Fever continued. And usually sometimes these rubrics will have, I'm just going to check, fever continued. There's a little flag. Fever continued. Typhus fever and typhoid fever were not clearly distinguished until the causative microorganism were isolated in the late 1800s. Typhus fever indicates continued or remittent fever, whereas typhoid fever points to a higher continued fever. Nowadays, continued fever is a synonym for typhoid fever. So continued fever is typhoid fever. Rubrics have been moved to typhoid fever or typhus fever if the distinction was clear. Oh, Q&A, good. Avoid making additions at continued fever to minimize ambiguity. If constantly high temperature is meant without implying typhoid fever, rather use the rubric constantly high fever. From research with help from Dr. Pierre Salin in France. Okay, so a lot of these fever rubrics, they'll have like a little blue flag which gives you information like this, or a black flag which gives you more of like a presentation of what it will look like. Let me see if I can get this Q&A. April, I have not been able to find anything about scalp pain during or after fever. Is there a rubric? Okay, let me look. Thank you for the question. So what I would do is I would look up heat and fever, and scalp is under the head. Okay, if it's skin, if it's all over, I would look under skin. But if it's just the head, we're going to look up heat and fever. Repertories. There's coldness. We can 530 something. We're going to go to. It'll be under pain. I'm just going to go down a bit. Heat, lots of heat in the head. Lots of heat in the head. Heaviness. There's pain. Let's see. Okay, pain. Headache. So head pain is headache. Okay, and you're looking for the scalp, correct? Head pain during hammering, hay fever, heat. So we're looking location, forehead, occiput, sides, temple. There it is. Well, there's perspiration of the scalp, pulsations of heat. Let me look at scalp. It's a good question, especially if the symptom is there. Perspiration of the scalp, perspiration, cold forehead. Scalp pain during or after fever. So my guess about that is that I would get the quality of the pain. What's the quality of the pain on the scalp? Because let me see. Dryness, edema, inflammation, itching of the scalp. Maybe what they've done, pain in the scalp. That's what I would do. So here's what I would do. I would go to the scalp, and there's during chill, before menses, neuralgic. I would look at the quality of the pain. Is it a biting, boring, burning, sore, squeeze, stitching, tearing? So I would look at you have the location, the scalp, and then you have the quality of the pain. And I'm not too sure. They haven't created a rubric for pain of the scalp. But what you can do is you can combine the pain of the scalp with the quality with pain, fever, and look under skin, because the scalp is skin. So I would combine. We'll see what's. I know that I think China is, China. Roger Morrison put that in there. Not very helpful. Maybe pain during heat. That's a little bit better. Heat is fever in this case. So I would look there. Let's see. I have a question. Well, let's see. Because it was so intense. So the pain in the scalp was intense. Verge of tears. Well, I'd have to get a little bit more information on that, but I would look up. I would, to keep my net cast wide, I would go to head. Oops. Head, pain, fever during, and then we go back, fever with, accompanied by. And I would look at some of these remedies. Belladonna has a really intense headache. So these are the remedies that have a head pain with, even if it's in the scalp. I would combine some rubrics where you have headache with fever, the type of pain in the scalp. So as head pain, location would be the scalp. And then what was it? Was it a boring, biting, burning? So what I found these days is it's very difficult for people to qualify the type of pain that they have, unless it's like burning. They're like, oh, it's a burning pain. But when you look at like biting pain, I don't find that the people they come around to that on their own very often. Stitching pain. So that's kind of what I would do. That's how I would approach that. It was a burning pain and then it was itching after the fever was gone. Okay. So it would be burning. So just write that. Hold on a second. Oop, wrong rubric. Just delete that. And then so the other thing would be pain followed by itching. Pain followed by, oops, got two eyes in there. Itching. Itching followed by pain. So your remedies that you're kind of looking at for just with what we can find in the repertory: scalp pain, burning, and headache accompanied by fever. You got belladonna, apis, rust tox. I would try to find, those are good symptoms, but here's something that I found over the years. When you're taking a case and you either discover something or the person says something and it's going to just cure the case, it gives you that piece that you're looking for, you kind of get this settled kind of like, this is it, where this is, it's almost like a knowing inside, like this tingly feeling, like, I got this now. We're good. And when you're taking an acute case, and it was in the example, as an example, when I told you, I posted on Homeopathy for Everybody, the person that had the pneumonia, and I'm kind of going through their symptoms, and then they kept going, what? Huh? What? And I was like, this person can't hear me. And I, corroborated with them. So we look up hearing impaired, what the head? Hearing impaired fever. Oops. Heat. During heat. There's euphrasia and rust tox, and there's also lost hearing during fever. And there's rust tox there. So as soon as I saw that, I was like, this is the remedy. And I gave it, and then I had the results that I got. So let me see. Good. I'm glad it was somewhat helpful. So yeah, you when you're other ways to search. If we want to look at, let's just say we wanted to look at belladonna, right? So we go to belladonna, and we type in fever. Oops, fever. This is a good way that I study remedies. All documents, and we're in Shroyan. I'm going to reduce this. So there's over 300 rubrics that are associated with belladonna and with fever. So we'll get rid of the grade 1 and 2s. Grade 3 is a really strong indication, so we can take a look at that. Delirium and fever, excitement, picking at the bedclothes, discolored face, speech difficult during fever, right? Thirst, pain in the upper limbs. They have location again. Let's see, speech difficult during fever. Belladonna is the main remedy. Interesting. And then of course it's going to get us into fever. Time of day and night. So what is typical for fever? Typically worse at night, so we don't really use that. I don't anyway. If the fever spikes like in the morning, right? Do you guys know the main remedy for the remedy that spikes, the fever spikes forenoon? It's a remedy that's worse right at around 10 a.m. We typically don't think of this remedy as a fever remedy, but I've used it to treat fever. I've used it to treat influenza based on, what was the symptom? Nausea from eating salt. Anyway, there's a nat mirror is the main remedy that gets the fever spike at around forenoon, which is about 10 a.m. to noon. But if the fever is spiking at night, that's typically what happens, right? So we want to know, is there anything unique about when the fever is coming on? What else about the fever? You have fever with dry heat at night with delirium. Okay, so they're qualifying the type of fever, right? You've got dry heat, so it's not a damp heat, so they're not heating up and perspiring at the same time. You have a time modality at night, and then you have a concomitant with delirium. So they're seeing things, they're reaching for things, they're prattling, and then what's a delirium? I don't have I had Yasgar on here, and when I updated, they took it away from me. Yeah, I don't have it right now. Yasgar is, I have the book over there on my shelf. Yasgar is a homeopathic dictionary, and it's a really good reference to have. You can get it as a book. You can thumb through it. I actually think the book is easier to navigate than the Yasgars that's been converted over to this program. But anyway, if you let's see if we just go to mind. Oops. Let's go back here to mind, delirium. Maybe they'll have a definition for us. No, they're just expecting us to know. There's a very succinct definition of what a delirium is. It's an altered state of consciousness, usually with talking or seeing things that aren't there. Or like if we go to delirium, there's a raging delirium. You've got agaricus, Bellus P during fever, from pain, rambling, raving, which is raving, which is raging. Delirium recognizes no one. So the point I'm trying to make is that rubric that we're just looking at had different components to it that you set it apart. It was a dry heat, you had a time modality, and then you had a concomitant of delirium. Look at this one. Fever continued at night, temperature running very high. So belladonna is the main one, but bryonia is there, hyoscyamus, stramonium. Again, that triad. Belladonna, hyoscyamus, stramonium, all solanaceae. Okay. There was something else I was gonna discuss. Do you know what an eruptive fever is? Let me just back up. Fever, eruptive fevers. Eruptive fevers are fevers that are associated with skin issues, eruptions, right? So eruptive fevers are usually associated with measles. And there you go, there's measles, scarlatina, scarlet fever. Okay, so that's what eruptive fevers are. And those are your main remedies. Again, puts you in the ballpark, but you have to do the footwork to get you to the right remedy. Exanthemas. So exanthema are things that happen on the skin. We got like 5 more minutes. Do you have any questions? We've gone over quite a bit of stuff. We talked about succession of stages. We talked about different concomitant things. Kristen says raising her hand. Go ahead, Kristen. What do you got? Let's see. That's a type in answer. Okay. Who taught me to use this program? I I taught myself mostly. What it's really about is about learning how to navigate, right? And I've been using radar probably since 1998 or 99. And so it's just I don't know how to use all of its bells and whistles, but I know how to get around. And there's this, I'm not going to call it an argument, but there's this theory that you need the book because the book, it's in hand and obviously it's cheaper, but it gets you to learn the repertory. You can learn the repertory through the computers. It's laid out exactly the same. The thing you need to learn that you're not going to learn in the book is what keystrokes do you use to get to where you want to get to, right? If you learn how the repertoire, like I know, if somebody put synthesis in front of me, it might take me a little bit longer because I don't have the search function, but I can get to the rubric that I need to get to by thumbing through it, or I can just use the power of the computer is being able to find the information you need in a fraction of a second versus thumbing through a book, right? So I taught myself, I actually do a free, um, um, we're going to make it monthly. Me and Anna, Dr. Anna Heed, she was one of my star students when I was teaching over at UNM. But I do like a monthly radar training on how to use it. I just grab like 1 or 2 cases that I've had, and we just it's a practice on how to repertorize, or how to if I go to the clipboard here, this is nobody's case in particular. You go to the clipboard and what does that green mean? That means that I've made that an elimination rubric, which means I can make it normal, and then it goes back to black. So I can limit or narrow down the size of the remedies I want to consider for the case. If you want to look at rubrics, can't look at blood, alumina, nux, aloe. That little asterisk means I actually went to a seminar, and saccharum and saccharum album, which is white sugar, they can't look at blood and gore. So I added saccharum album in there because we have 2 remedies that are the same. Saccharum album and saccharum officinalis. I think if we go in here, just type in SACCA, there's saccharum album and saccharum O. That's the same remedy, officinale. And the thing is how they were put in the repertory. They were put under 2 different names, but it's the same substance. White sugar is the same as saccharum officinalis. And just as an aside, so you know this, anytime you see officinalis or officinal, like if we look up China, you have Boliviana, and there should be China officinalis right there. That means that its designation is that its first use is medicinal. Like so herbalists, doctors, whatever you want to call them, people that used that substance, they didn't use it as, they're using it as a medicine or something to treat something. So that's what saccharum officinalis, China officinalis, all the other plants that we have with officinalis as its last name means that it wasn't used as an herb to garnish something or make something taste good. It was used originally as a medicine. Okay. I think we're at the 1.5 hour point. Again, there's so much. I mean, if we wanted to study just remedies under like fever, these are all such good remedies. Arnica, if we just take a quick look at, let's just look at arnica as a remedy for fever, because it's a big remedy, right? It has all of its keynotes where the bed feels too hard. Just look up fever. This is the way that I study materia medica sometimes. Picking at the bedclothes, indifference. It's used for typhoid fever, stupor during fever, right? Unconsciousness. So again, a lot like hellebores. What was the other one? Muriatic acid, opium. So if they have a fever, they're unconscious, you can't stir them, you can't wake them up, then you're using unconsciousness or stupor during fever. Okay, I think stupor is a little bit different. I think they can kind of, where is the rubric? Stupor, kind of come in and out of it. And this is a case where I would use the Asger to look up the exact definition of stupor versus unconsciousness. Anyway, there's just so much to study. I hope this helped you out. Yeah, I got through most of what I wanted to talk about, but there's a lot more. Maybe we can do this again. If you'd like to, let me know. I'd be happy to. Again, my main intention for doing this is to empower people. I don't want people that need to come to me. I need to take the information that I know and disseminate it and get people trained up, because really when homeopathy anytime it goes to a low point, it's mothers that keep the homeopathy going, because they want alternatives to drugs, they want alternatives to pharmaceuticals, and homeopathy really answers that need. So if there's any way that you want to keep doing this to, we can go over more fever remedies. We can use a different format where we just look at remedies and the key indications. But really what's really important in is garbage in, garbage out. So if you're not taking the case properly, you're taking symptoms that are just too big and too broad, we're not going to find the right remedy. Like if an absolute novice or somebody doesn't know what they're doing takes a case and they present somebody like me that has almost 20 years of experience with the information they've taken from the case, I'm going to have a hard time finding the remedy. You have somebody who's a master at it, they've got 40 years of experience, and they pull out, they boil the case down to the pertinent information. They can hide it in there, maybe in a paragraph. You can get somebody who's a novice in homeopathy, but the right information's there, so they could have a much higher chance of finding their curative remedy. Oh, yeah. So I had somebody earlier today who was sick last week. I recommended a remedy based on what they were going through. I said, your constitutional remedy might help you because I know it's a remedy for, excuse me, it's a remedy for acutes. And so what the person said to me today was, I said, describe the fever that you had that they got over. And they go, when you get a fever and you get really dizzy, I'm like, oh, it's interesting. So this person chronically, when they get a fever, they get dizzy. And the rubric for dizzy is vertigo. So I double checked. I said, dizziness during, and their constitutional remedy that I'm giving them for all their GI stuff and some other stuff that's going on is Nux vomica. And she said two things. She said the fever came on really fast, and she said that I was dizzy with it. So you put up this, I'm going to just pull that into that clipboard, and I went fever sudden, and it brings us to paroxysmal fever. And lo and behold, look at the remedies. There's Nux number one. And I had just recommended, I said, right when she goes, I don't know if I can make my appointment on Saturday. This was Thursday because I'm coming down with the flu. I'm not doing well. And so I just messaged her back. I texted her back and I said, you might want to grab a Nux Vomica 30C and just take a dose. It might help you with this. She took Nux she developed a fever on Wednesday, late morning. Thursday, she took the Nux Vomica. She said her fever broke on Friday. She didn't take any more Nux, just one dose of 30C. The fever broke on Friday. She rested Saturday, Sunday, Monday. I think she would have been even healthier if she'd taken the 30C like once or twice more. Tuesday, she was back at work. So her whole influenza lasted, the cough, everything, the malaise, the fever, it all lasted 5 days total. And she was back at work. And this flu that's going around, it's knocking people out 7 days, 10 days, 14 days, and they're having these persistent symptoms, usually respiratory stuff like a cough. So anyway, just dizziness with fever, right? Very straightforward. Not everybody gets dizzy with their fever. So that's an example of knowing your materia medica, knowing the rubrics and where your repertory, knowing where to look. And it helped me to help this person. So anyway, let me see, were there any other questions? Chat. Oh, great. All right. Well, I'm glad it was helpful. We'll do it again. Thank you for your time. And thank you for those that donated. I appreciate it. And we'll see you around. Okay. Thank you. I'm going to end. Share.